There's only a few things to take away. Know what sepsis looks like. So in other words, it's an infection and 2 or more signs of systemic inflammatory response. They're tachycardic, they're febrile, they're tachypnic, have a high white count. And if they have those things, they have to quickly identify how sick is the person, and so they'll get a lactate level. And if they can do that, they can start to prioritize how much danger the person's in. And if the person does have an elevated lactate or they have another organ dysfunction, they have to quickly intervene, mainly with fluid resuscitation. Hopefully fluid resuscitation works because we don't have a whole lot of treatments. Antibiotics are critical, source control is critical. The nurse has to get blood cultures down to the lab right away. And so the idea would be is if they're able to quickly do those things, they have a chance of saving lives. If they wait even an hour to detect it, mortality changes.
It's amazing that time frame is so close, but sepsis is one of our forms of shock, and it's one that the body doesn't really respond very well to at all.
No, not at all. The sepsis is lethal. When you look at septic shock, it's as dangerous, like you've said, as cardiogenic shock, hypovolemic shock, in many cases maybe even worse, because there's no effective treatment. Where hypovolemic shock, we often can resuscitate people. Cardiogenic shock, you might be able to do something to support a failing heart. But in septic shock, we don't even really understand the mechanisms of the disease. So we throw treatments at it. But right now, in the year 2013, we're still kind of blindly throwing treatments at it because we don't know what causes it.
And it's one of the things that I think a lot of research is going on about. What are some of the things on the future or on the horizon for sepsis? What are some of the things that researchers are looking at now?
That's a great question. A good colleague of mine, Rob Taylor, was the past president of critical care medicine, said every time we do a lecture on sepsis, the next year what we told you was wrong, because we keep changing what it is that we're learning. We don't have a cure for sepsis on the horizon. What we do believe, if there is going to be some type of cure, it's going to be targeted. It might be targeted genetically, might be targeted inflammatory mediators. It may be targeted to things like apoptosis. Unfortunately, those are all still in the experimental phase. When you do talks on sepsis, it's encouraging to teach nurses to be quick, to recognize it quickly, because then we have a chance of saving somebody's life. If we wait, they get into the ICU with multi-organ system dysfunction, we really have no effective treatment. So I wish I could say we've got a great new treatment coming on the horizon, but we don't. I wish we could say we have a new 3D printing organ transplant that we could do, but we don't. So hopefully some researcher out there is going to surprise us all and find something that works. But unfortunately, for the near foreseeable future, sepsis is going to be all about prevention.
And that's the CMS is focusing on prevention. They want us to make sure that our patients are not acquiring infection in the hospital. And so it's early recognition and prevention are the keys.
That's exactly right. The one thing that will help is when CMS makes these a core measure, which I believe will happen next